You know what time it is, no matter where you've been. So let's do it again. Listen up and let the sun shine in. We've got soul training. Time to practice what you preach. Ooh, yeah. Yes, we do. We've got soul training.
Good evening, Daniel and Joe. How are you?
Just right, brother. How about you?
I'm doing good, Joe. What's your answer?
I'm doing great.
That's awesome. I wouldn't expect anything less. One of my favorite people to listen to, he's deceased, but I still find him on YouTube, is Zig Ziglar. Zig Ziglar will always say something like this: I would love to give you counseling advice. I'm not a counselor, but I know people who are. So I think that's fitting tonight. We have a professional, Dr. Neil Richey, that's in our presence digitally or through cyberspace, not in our room literally. He is going to be here with us, and we're going to talk about some very interesting topics, probably a couple of big ideas. I think I heard you say maybe a two-parter or something like that. So, and I've taken some notes, or I've prepared some notes because of questions, and so I know you all are always or have a lot of good questions. So we have a very resourceful, qualified, credentialed gentleman, and he's also a brother in Christ, and we're very thankful for all of that and more. So, Dr. Richey, if you don't mind, just tell us a little bit about Dr. Richey and how you can help us understand mental health, and also maybe help us understand maybe the weight of caring for those in our family. Maybe that's another episode, but as we deal with mental illness and mental challenges, just kind of tell us a little bit about you.
Sure. So about 1998, I believe it was, I graduated from Freed-Hardeman University, and I received a bachelor's degree in communication with an emphasis in broadcasting. And so what we're doing right now actually is pretty exciting to me because I went to school for it. But
that's perfect. I didn't even know that about you.
Yeah, exactly. But I always knew I wanted to be a preacher. And so I went to preaching school as soon as I graduated from Freed-Hardeman over at the East Tennessee School of Preaching, which is now the Southeast Institute of Biblical Studies. And they have, in addition to certificates, they actually now are awarding a Bachelor's of Biblical Studies degree, which is kind of neat for students coming out of the school there. And so I graduated from that, and I went right into the work of preaching. And so for the last 25 years, I tell folks that I've been counseling, but I only figured out what I was doing in recent years because I was approached by the eldership of the church down in Atlanta, well, Marietta, actually, outside of Atlanta, asking if I would consider going back to school to study professional counseling. Because, and their words were, we need counselors that we can trust. And I thought, well, I sort of had that in the back of my mind. I'd like to do that at some point in time, but never thought that I would have the support of a local eldership to go and do that, because it's, as you know, it's quite time consuming. But they were 100% behind me. So I went to Amherst University and earned a Master of Arts in Professional Counseling and got right into practice down in Georgia. I worked for a couple of clinics. One was a clinic called Tranquility, and the other one was Canton. And I'm actually still doing clinical work in the Canton counseling practice in Georgia. However, I currently live in Virginia, so all of the clinical work that I do in Georgia is by way of telehealth, which, by the way, increased at a rate of 300% during the COVID
I bet it did, yeah.
crisis. Yeah, it was huge. And so I really got into it, started realizing I was helping people in ways that I had never been able to help them before as a professional counselor. And so I decided that I wanted to go further. I went to the University of Cumberland's in Williamsburg, Kentucky. Maybe not far from you guys, I'm not sure.
A couple hours.
But is it?
Mm-hmm.
And I received a PhD in counselor education and supervision. And so sort of what that did for me, it opened up a door to be able to be a professor at Freed-Hardeman. And so I'm actually wrapping up a semester right now teaching advanced ethics and legal issues and behavioral health care to doc students. And so that's been pretty rewarding on a professional level. And then, of course, also it's been rewarding just helping folks deal with their stuff, if you will. So in addition to that, as I said, I've been preaching for 25 years. Personally, I've been married for 25 years, and I've got 2 kids. I've got one that's a sophomore at Freed-Hardeman, and then I have one that's 12. And she said she's never going to college because she once visited her brother's dorm room and there was a bug on the wall, and that was enough for her. And so she's not going to college. However, she wants to be a school teacher. At least that's one of her professions. And we told her, you can't be a school teacher unless you go to college. So she'll have to get over the bug thing in the dorms.
Well, that's true. Well, that's a great journey.
The only question I have, and I'll let these guys jump in, when I saw your name, have you ever been interviewed by Dale Jenkins? For like Ministers of Mocha?
Not Ministers in Mocha, but it seems like I was interviewed by him for something that he and Adam Fond were doing back several years ago.
Okay, I was thinking that you were a guest because there was a gentleman, it just it fits everything that you just talked about, and they kept talking about Harvard by the highway. I don't know, that was some little junior college in Alabama or Georgia, I'm not sure, but Dale had interviewed somebody, and it was a very interesting journey too about what you just said about going back to school and counseling that you can trust within the church, and so that's awesome. But I was just curious. I'm a Jenkins Institute member, follower.
Shout out to the Jenkins.
Shout out to yes. I'm all about Dale and Jeff, and I knew their dad Jerry too. So
I used to go to camp with Jerry during Jerry Jenkins week at Maywood. So
well, how about that?
Wouldn't it be awesome?
Closing the circle here. I love what that congregation, that eldership did for you, and wanted to help you to get some professional education so that you, like you put it, know what you're doing. What do you think? I know this is too broad a question, but just briefly, that extra education about counseling and mental health that you were able to get, what do you think that really helped you to do beyond what you were doing just in pastoral counseling, like most preachers, doing the best you can, from the Bible and from the experience you've had?
I think that's a good question. What typically happens in as you said, a pastoral counseling, and I'm actually going to say it's not pastoral counseling, because pastoral counseling truly requires specific training. And most folks who are preaching have had maybe a class in counseling, maybe
right.
more than one class, but typically speaking, they don't have a lot of training in doing pastoral counseling. We just happen to call it that because we're preachers, and the world has given the preachers the title of a pastor, and therefore, if you're a preacher who counsels, you sometimes think of that as pastoral counseling. But in reality, there's not been a lot of training in what we do. And so from a standpoint of the professional side, it allows me to know how to listen better listening skills. It helps me understand that when I'm sitting with someone, it's not about the content that they're sharing necessarily, but it's about the process that we're engaged in those moments. Because a lot of times people come in and they're all over the board with their content, and you get lost in it. But if you can just focus on the here and now and what you're doing in the moment with that person, in my case, a client or a patient, depending on what school you go to, if you can just be engaged in that process where you're watching their body language, you're hearing the tone of their voice, you're kind of watching the connection that's happening between the two of you in that moment. And you're just very observant. Some of those types of skills are things that you just don't develop in, a few weeks in maybe a preaching school class, or maybe even at a Christian university where we're studying or training to be preachers, and we just spend a few weeks learning about counseling. We just don't get as much as we really need to do a quality job of counseling, if that makes sense.
Right. It's sort of the difference between, it being a hobby and something that you do professionally.
But still, it seems like one of the things I heard you talking about there, and this is Joe, by the way, I know you don't know my voice, but as Christians, we are to rejoice when others rejoice and be there when others have times of despair. And something that the common Christian can do is be there and listen and be that shoulder for them to lean on. Am I getting that from what you just said?
Yeah, absolutely. We certainly can. In fact, it's not only something that we can do, we must do. Bear one another's burdens and so fulfill the law of Christ. And so there are some burdens that we can't bear, Galatians 6:1-4, such as sin. I can't bear your sin. But there may be another burden that you're bearing that I can help you bear. And perhaps it's just by sitting there. Maybe I don't even say a word. Maybe I just sit there. Maybe if you're crying, then I cry with you. And and sometimes that's the case for me. Depends on the situation. Obviously, sometimes a client comes to see me and everybody else in their world is falling apart, and they have to be the strong one, and they need to go talk to a professional who is not going to fall apart so that they can. And so even though I may be tempted to cry along with them in that moment, it may not be what they need. But with respect to what you're talking about, absolutely. We sit there, we cry with, we laugh with, we hold one another, if appropriate. That's a part of the Christian counseling piece, if you will.
Yeah, I don't feel like we're always willing. From my experience, Christians are always willing to listen and be there, but sometimes we're not willing to reach out to have someone listen to us. I know personally I'm not. That's something, I don't know, maybe it's me being stubborn or a man, or you could probably tell me, but I don't reach out like I should. But I've got a verse here that as we're talking about mental health, that I've heard this quite a bit throughout my life. When someone has dealt with anxiety, what you hear is Matthew 6:34. Therefore, do not be anxious about tomorrow, for tomorrow will be anxious for itself. Sufficient for the day is its own trouble. How, from a Christian perspective, there sometimes worries come, and they may not be necessarily founded in anything concrete. I know there was a time where I was struggling with, several years ago, anxiety and depression, and I had, at that point, everything in my life was absolutely perfect, but something had hit me, and I couldn't get over it. And I feel like sometimes there's a bit of a stigma in the church with mental health that we feel like we should just pray it away, Can you talk to that a little bit? Does this make sense,
Sure.
what I'm saying to you?
It makes sense. And it's sad, the stigma of mental health. Mental health is a disease. Mental health is an illness. When I think about that reality and I contrast it, or compare it rather, with physical illness, some folks will say, well, here's someone that has diabetes, or here's someone that has a heart disease, or here's someone that has cancer, one of the big three. We'll immediately say, go talk to your doctor. We'll encourage them to seek treatment. We will be prayerful for them that they get the right treatment. We're hopeful that the medication that they take is beneficial, that the chemotherapy that they have will arrest the cancer. But we don't often do the same thing. Now, I do think it's a little better than it used to be, but we don't do the same thing for mental health illness or a mental health disorder. We sweep it under the rug. We say things that are ignorant at best, but dangerous at worst, like, why don't you just pray about this more? Or why don't you read your Bible more? Because if you do those things, then your mental illness or your mental health issue or your anxiety or your depression or whatever will go away. Well, those folks, while possibly well-meaning, they don't really know what they're talking about. The reality is that approximately 10 to 15% of the world deals with a mental health illness. And I believe that number is probably low. I did some research on the state of Georgia once upon a time, and just over 8% of the population in the state of Georgia had presented, meaning that they had sought help for some type of a mental health disorder. So if we just round that to 10%, that number is huge. Well, did you know that mental health disorders are often more prevalent than cancer, diabetes, and heart disease, but they're more treatable? So if the stigma exists, people are not being treated for it, and therefore they're constantly living in pain and agony that they don't have to live in, but they're afraid to seek treatment because of what somebody may say. Because Christians, they're supposed to have their act together, right? They're supposed to not have any worries. They're not supposed to have any anxiety, because the good book says, be anxious for nothing, right? So, I think maybe the next question is, well, what was Jesus talking about there when he says be anxious for nothing, or be careful for nothing, as some translations say? He was not referring to what we might refer to as a DSM, Diagnostic Statistical Manual of Mental Health Disorders. He's not referring to a DSM, a clinical level of anxiety. He's talking about someone who's putting too much thought. In fact, the King James Version uses that language. He's talking about someone that puts too much thought on something themselves rather than turning it over to God. Well, what happens if you do that in the beginning of the stressful matter? Well, perhaps you can sit down with a brother or sister. Perhaps you can engage in some prayer, maybe even fasting, some scripture, and by and by, in a short period of time, that worry tends to go away. But what if someone didn't do that? What if someone wasn't as aware of Matthew 6 and other passages? What if they didn't seek counsel from a brother or sister that they could trust, and they ruminate on that stressor, that thing that's making them anxious, and they ruminate on it? Then guess what? They have trained their brain to become anxious over a matter. And so now, because of the fact that a brain has this quality called neuroplasticity, meaning it can change, their brain has now become an anxious brain. And so to tell that anxious brain, okay, go read your Bible, go pray, is not going to do any good. Maybe they're spending a lot of time doing those things, but they're still anxious. What they need to sit with a professional that can help them to rewire their anxious brain. And once that brain is rewired, then Jesus's words are a little more doable for them. Does that make sense?
Sure. So what would you say to our dear listener, somebody sitting out there in the pew, they're religious, they've heard these sermons about anxiety and worry and all these sorts of things. How would they know when it's time to go and seek professional help?
Well, I think the first thing that I would say to them, and I have said this to Christians before, that I'm sorry that you have been looked over. I'm sorry that you have felt as though no one is taking your situation, your struggle seriously, that you have been so challenged by this, and there's been such a stigma associated with this that you feel like you can't open up, you can't talk about it, you can't get the help that you need. I think that's where I would start. I want them to feel like there are people that will listen. There are people that will hear, that want to help them. And I think, to answer your question, how do you know? It's pretty easy, actually. When you look at the DSM, the Diagnostic Statistical Manual, the latest edition. So there's the DSM-5, and then there's a DSM-5 update that came out in March. I'm still waiting to get my hands on my copy. And just for the listener, that DSM is gives us the information that we need to be able to diagnose mental health disorders. We get what that ICD code, that code that we turn over to insurance companies so that we can get reimbursed for treating a patient. But that DSM may say something like, have you been dealing with this for most of the day, nearly every day, for the last, we'll say, 2 weeks. Sometimes it's longer than that. Has it impaired your ability to work or to engage in normal activity? Has it caused you to lose weight and you're not trying to lose weight? Has it changed your appetite so now that you're gaining a lot of weight? Things like that. So we would look at that DSM, and there's a lot of information even out on the interweb where you can say, okay, I think I've got anxiety, and you look it up on Dr. Google, and it will just have some of those symptoms, and you can say, yeah, some of those symptoms they look like they fit me. Now, I'm not encouraging you to self-diagnose. I'm just saying it might not be a bad idea if you're struggling in life to look up those symptoms and say, yeah, that sounds like me. Let me call someone. And I'll give you a really good resource. Of course, I'm happy to be a resource, but a really good resource for people in their community is something called psychologytoday.com. And when you go to psychologytoday.com, you can actually put in what you're looking for by way of a clinician. Do I want a male? Do I want a female? Do I want someone that comes from a Christian worldview or not? Do I want someone that certainly you can put in your zip code? Do I want someone that takes my insurance, or do I want to self-pay? Things like that. If you've done, some people that I treat, they've done a lot of research on best modalities for treatment when they're dealing with a mental health issue. And so they may say, okay, I want someone that specializes in cognitive behavioral therapy, or I want someone that specializes in EMDR or whatever, so that's a really good resource for folks.
That actually addresses my next question. I'll go ahead and ask it in case you want to elaborate. But I was thinking about the Christian out there that may be hesitant to seek professional counseling because they're worried about somebody influencing their worldview from a non-scriptural standpoint, especially with regard, there's a lot of areas out there where the world and the Bible see things differently. So what are some maybe questions you would ask or advice you would give to somebody in finding someone who they could feel comfortable in seeking mental help from, that's not going to, be a jeopardy to their faith, if that makes sense?
Sure. No, it makes perfect sense. And as I mentioned, that's one of the reasons that the leadership at Piedmont Road in Atlanta, where I was at, so they wanted me to go do this training, right? So I think one of the things that I would say to someone that's searching is professional counselors who are quality counselors. They're not seeking to reroute someone's faith. I know that there are some who practice unethically. It's the unethical counselor who would try to reroute someone's faith. The professional counselor who practices with respect to their code of ethics, and I'm thinking specifically about the ACA code of ethics, and you can go online and you can just type in ACA code of ethics and you can look them over. And in doing that, if you are in counseling, you can hold your counselor's feet to the fire, where you can say, hey, look, this what you're doing right now is not in keeping with this code of ethics. But a counselor who is ethical is going to really just listen and ask open questions so that the client makes the decisions for themselves and not the counselor making the decisions for the clients. I think that's the misnomer about counseling sometimes, where you go see a counselor is going to give you advice, and then your life is changed, hopefully, for the better. But a good counselor is not an advice giver. I always tell my clients that you've come to see me, but it's, you may have come to seek advice, but I'm not here to give you advice. Because if I give you advice, I don't have to go home and live with the consequences of that advice. So my job is to listen to you, and my job is to help you see within yourself the ability to heal. Now, here's what I mean by that. I practice what Carl Rogers called a person-centered or a client-centered approach to therapy. Okay, person-centered therapy. And basically what that means is that each person has the ability to self-heal. Now, as Christians, we understand that God puts within us that ability to self-heal. So my job as a counselor is to help you find what you need within yourself to be able to heal. Okay, so now I may have some other tools that I utilize. For instance, I mentioned cognitive behavioral therapy. I really like that process because it's very biblical. As a man thinketh in his heart, so is he. Right? So we've got our cognitions, our thoughts, we've got our feelings, our emotions, and then our behaviors. So I like that. So I may utilize that when I'm treating someone, but I'm still doing it from a person-centered perspective. I just help them find those reframed cognitions within themselves. I don't know if that helps to answer your question or not, but it's something that gives me a little bit of peace when I think about Christians going to counselors who may not necessarily be Christians. They're not out there trying to wreck the faith of Christians. Now, there's some bad counselors out there for sure. So you might do your research and see, has that counselor ever been before the ethics board for violating their code of ethics?
Well, that's good to know that the patient has certain, rights in the relationship there. I appreciate the insights that you have brought to this, and I think it'll be helpful for some of our listeners. Dear listener, Dr. Richey has generously agreed to stay on for a second episode, and so we're going to wrap this one up now. I want to thank him for his time and making this a priority. He's in a different time zone than us, and we're keeping him up a little bit later than we are, and we appreciate that from him. Of course, I want to thank my co-host, Alan Jones.
Is Alan still in the room?
Yes, I'm still here.
He
Taking note.
he grabbed a piece of pizza, went out in the hall. I don't know. No, he's here. And then, of course, we want to thank Big Show Joe for working the magic that he does. And we want to thank the elders at the South Green Street Church of Christ for making soul training possible. And to you, dear listener, thank you for making us a part of your day.
Easy for you to say.
Yeah, that's right. So until next time, keep soul training.
Soul training. Time to practice what you preach. Ooh, yeah. Yes, we do. We've got soul training.
To learn more, you can email us at soultrainingpodcast@gmail.com, or you can write to us, P.O. Box 503, Glasgow, Kentucky, 42142. That's Soul Training.